W5.
How afraid should people be?
Panicking is not going to help.
Leading the fight against a worldwide outbreak.
Millions of people are now under quarantine.
There are more than 118,000 cases in 114 countries.
You can't sugarcoat it. This is a dangerous virus.
And
I know for sure that the world I left behind's dead and gone.
jailed for life and trying to come home.
You can't just put an 18-year-old in jail for life.
We only want our sons close enough to be able to see him.
I want him to be able to come home.
CTV's W5 with Avery Haines, Sandy Ronaldo, and Lisa LaFlamme. Here is Avery Haines.
Hello, and thanks for joining us. Every day, the news about the coronavirus seems to get worse. It's a pandemic. The numbers of those infected keeps growing. Governments are desperately trying to contain it. Well, there's one man who has the ear of governments around the world. His name, Dr. Bruce Aylward. He's been battling dangerous viruses for nearly 30 years. He's a Canadian from Newfoundland and the World Health Organization's lead investigator. In an exclusive interview with W5, he sat down with us in Geneva, Switzerland, to talk about the virus, the pandemic, and what's next.
Health officials in China are working to contain the outbreak of a new mysterious type of pneumonia.
The underlying cause remains unknown.
The government is extremely nervous.
Millions of people are now under quarantine.
How deadly is the virus? How contagious is the virus?
COVID-19, public health enemy number one.
The whole world needs to be on alert. The whole world needs to take action.
The fast-moving virus has now moved across Asia.
How do you stop all of this panic? That's the big question.
COVID-19 can be characterized as a pandemic.
The Prime Minister's wife has now tested positive for COVID-19.
This stark map shows the invasion as red dots expand into overlapping circles of coronavirus territory. The world is at war with a virus. The life and death quest for answers on how to contain it lie here inside this building in Geneva, Switzerland. The World Health Organization is tasked with the monumental job of trying to coordinate an international response.
I thought we had it pretty clear until Italy decided that they were going to do.
And this renowned Canadian doctor, a former Assistant Director General for the WHO, plays a crucial role. No stranger to frightening diseases, Dr. Bruce Aylward has spent his career tackling global health emergencies. Ebola.
This is a global health security issue.
Zika, polio.
You know, there's certain mathematics to infectious disease outbreaks.
And now, he's the WHO's go-to doctor for COVID-19.
We don't shake hands at this point, no. And we're probably too close. We should be a little further apart.
Oh, like further apart?
The most important thing is going to be keeping a little bit of distance.
Like this?
Like that. A meter is good, right. And but even then, we're not directly across from each other, so it's not going to be as big a risk.
Dr. Aylward, originally from Newfoundland, led an international team right to the front line of where this all began, Wuhan, on a fact-finding mission at the height of the lockdown in the Chinese city. He has compiled groundbreaking research on the mysterious disease.
This is a virus that spreads right around the world very, very quickly. You can't sugarcoat it. This is a dangerous virus, a disease that causes this kind of societal disruption, this kind of economic devastation, this kind of a human cost. This is awful. This is horrible. But you spend your life in careers like mine, training to be able to work in these situations and to be able to help.
With the United States banning most travel from Europe.
Good night, fans.
With Major League Sports suspending their seasons. With the stock market in free fall, Dr. Bruce Aylward says the world needs to unite to fight this common enemy.
This is a biologic process. This is a virus, and we can predict so many things, but then there's a lot of chance involved, so sometimes we just don't know. Why does it take off in one area? Easy to blame, really unhelpful when you're in the middle of a war. Right now, solidarity, slow it down, shut it down,
You describe this as a war, and the enemy is invisible to most of us.
Absolutely. I mean, this is a virus, and it's a virus that makes people sick. It survives in human living cells. It has to get from you to you.
And the key to winning a war is knowing your enemy's next line of attack. Do we know this enemy's next line of attack?
When people ask me, about the gaps in the knowledge of this, it's like, how much do you need to know? I mean, you're in a war. Do you need to know your enemy's postal address, what color underwear they're wearing, what they had for dinner last night? With this virus, you don't have to know everything. But we're going to learn more as the virus ends up, unfortunately, in other countries.
And that's the scary thing, is that we're learning in real time and people's lives are on the line.
Yeah, but what's impressive is how much we're learning, how fast. And again, it is a nasty virus, but what we're learning is we can get little sights into the chinks in its armor very, very quickly and exploit those. For example, China realized quite early on was actually some people seem to be transmitting the disease before they get sick.
So they're infectious before they're showing any signs.
Exactly. But what that tells you is, whoa, you've got to go a couple of days before the person gets sick, find those close contacts as well. So despite all this stuff we don't understand about this disease, if we use every little piece we have and apply it rigorously, we can actually save, we estimated, hundreds of thousands of people from the disease.
And this is startling. There is a growing consensus among medical experts, including one of Dr. Aylward's colleagues from Harvard, that the vast majority of people in the world will become infected.
A good friend of mine put out a model that was said, within a year, 60% of the global population will have been exposed to this.
60% of the population
would the global population
have COVID-19?
Who knows what the real number is, but it's a lot.
That's a terrifying number.
That's why you don't want to let this virus run.
80% of people who test positive for COVID-19 will likely have mild symptoms. About 20% are severe or critical. And the WHO estimates upwards of 3.4% will die from the disease.
People are still surprised. They say, whoa, we've got a case here today. Sorry, you have to expect this virus is coming. People are calling it a pandemic, and then they're still being surprised that it's in their country. We've had weeks to prepare for this, to get ready very, very fast, and there's still gaps in the response. What I find that surprises me still is people don't know what COVID disease is. They think it's a runny nose or a sore throat. It's not. It's a fever. 90% of people have a fever. 70% will have a cough.
And while the most at risk are the elderly and medically vulnerable, Dr. Aylward is haunted by an astonishing discovery he made on his mission into Wuhan.
Why do some young people die so fast? That keeps me awake at night. What we found was there are 30-year-olds, 40-year-olds, 50-year-olds, perfectly healthy folk who will die if they get this disease. We don't know why. What is it?
And were you able to figure it out?
No, and that's really scary. That's a big gap in our knowledge.
And which still has not been solved. We still don't know why
and it may never be.
Do we know why children don't seem to get this or don't seem to have serious effects of it?
What we do understand is children definitely can get infected. There's no question about it. They definitely can get disease, but what's different is they seem to get milder disease and they don't seem to be as effective as transmitting it to others.
How long do you think it would take before a vaccine is available? And will it be quick enough to deal with this wave?
No, for this wave, definitely not. Your earliest date, 6 to 12 months, that's really early. Longest, never. We don't have a vaccine against HIV, and we've been at it for a long time. Now, coronavirus is a different kind of virus. It's more stable. We should be able to do this, but we've never had a successful vaccine for a coronavirus.
You've described COVID-19 as the Wayne Gretzky of viruses.
Think about it like this. It's not the biggest player necessarily, may not be the fastest player, but the combination is potent, right? And Gretzky finds the net. This virus finds the susceptibles.
This seems as though we're watching scenes from a science fiction movie with plot twists by the day. How afraid should people be?
we're watching an outbreak evolve. So people should be concerned, they should be informed, they should be doing the right things and managing it, but panicking is definitely not going to help. You panic when, you're on a sinking boat in the middle of the ocean with no, lifeboat and you can't swim. This isn't that situation. We know how to manage it, and there's so much that can be done. So be concerned, be prepared, but panicking is not going to help you in this situation, and you don't need to. There's so much you can do at an individual level to protect yourself even.
When you see the stock markets tumbling, when you see everyday life being disrupted in so many different ways, does the coronavirus have a secondary residual sort of fallout for people that's almost as bad as the disease itself? I mean, it's upended everything.
Yeah, it's a really important question because countries are trying to maintain as much of normal life as they can and find that balance, and as much of economic activity as they can, because as soon as they start suspending events, et cetera, there's big financial and economic knock-ons for these. But what they're finding, unfortunately, is they don't have a lot of leeway with this virus. Like, take the hit early, keep the case numbers down really low, because if you delay, you're going to end up with not tens of cases or hundreds, but thousands of cases. And they're going to be sick for weeks, not for days, which means, and it's shedding virus, which means you've got a really stuffed up health system that can't manage other things, let alone severe cases of this.
Coming up.
Pandemic is not a word to use lightly.
The facts and fictions of COVID-19.
Do you think that it will be contained?
I think it can be contained.
When W5 continues.
COVID-19 has been declared a pandemic.
We're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction.
The World Health Organization now predicts this infectious disease will hit every single country on Earth.
We have never been before seen a pandemic sparked by a coronavirus.
In Geneva, Switzerland, at the WHO headquarters, renowned epidemiologist Dr. Bruce Aylward insists there is no time to waste.
We have to move fast. This can get from person to person fast enough, and it can get out of control fast enough, but it also, there's a window to be able to deal with it.
The Canadian doctor has dedicated his life to infectious disease emergencies, Ebola, Zika, polio, and most recently, he led an international team right into the epicenter of COVID-19, Wuhan, China, where the virus is first believed to have jumped from an animal to a human. In just a few short months, the virus has swept through more than 100 countries. There was a media ban on coverage of the international mission, but Dr. Aylward has agreed to share some of his personal and rare images of life at coronavirus ground zero.
Even getting into Wuhan was difficult because the city was shut down, right?
They stopped the train, stopped the plane, so this is a dedicated bullet train that zoomed us in 4 hours.
This just extraordinary scenes of just completely desolate.
Yeah, this is heartbreaking. This is Wuhan train station. Should be tens of thousands of people every hour moving through there, and it's empty. This vast, cavernous, hyper-modern, nerve center of China, silent. And the trains go roaring through there. The trains still come through, but with the blinds down, they don't stop. And the people of Wuhan, they're watching the world pass them. It's heartbreaking.
These photos show nurses and doctors dressed in protective gear in an isolation ward, video chatting with the international team a couple of floors below. And this, a stadium that was, in a matter of days, turned into a makeshift hospital.
What they did was they repurposed the stadium to be able to take all the mild cases. Severe ones went into the hospital, the milds went there. And in 72 hours, they could build 1,000 beds.
Dr. Aylward says the world needs to learn from China. The drastic measures they took, he says, appear to have paid off.
What we saw in China is they could use fundamental measures that we never thought would stop a virus like this that actually seemed to be reversing the course of what was the worst outbreak there. China has had no cases anywhere since, except Hubei, for days. They took their existing hospitals and they said, okay, which one is going to be the designated COVID hospital for this city? Not the COVID bed, not the COVID ward, the COVID hospital. They moved a third of their consultations onto online. The elective stuff they suspended.
In the beginning of the outbreak, China was heavily criticized for not reporting the spate of mysterious illnesses quickly enough. But Dr. Aylward maintains that the steps they eventually took saved hundreds of thousands of lives.
They were the pro league, and what we're seeing in other places is sometimes the amateur league.
If one country is sloppy and it gets out of control and it does not contain, that affects the next country, and it's like a falling dominoes.
Absolutely. And to your point, it is an interconnected world. And if the country next door, it has a bit of a sloppy approach and the virus comes across, you still have a duty and responsibility to your citizens to minimize the potential impact this could have. So make sure they're educated. Make sure you find those cases and isolate them. Make sure you find the contacts and quarantine them. Make sure that you shut down any kind of events that are amplifying this. And use the evidence to drive your response, because you'll save a lot of people from the disease and you'll save a lot of people from dying.
This isn't the first time a respiratory coronavirus triggered fear worldwide. In 2003, SARS made the jump from an animal to a human in a market in China. More than 8,000 people were infected worldwide. Some 800 people died. Outside of Asia, Canada was hardest hit. For months, hospitals were on lockdown. Tourists stayed away, and dozens of people, mostly in Toronto, died. It created an unprecedented challenge to our healthcare system.
Canada had a trial run with SARS. We've been down this road before.
You had SARS and learned from SARS that, whoa, we need a public health agency to manage public health risks. So you've been building that capacity.
How would you rank the way our country has responded to COVID-19?
I'm impressed. I think Canada has been preparing for this and preparing well for decades. Canada was rapidly finding importations in multiple provinces, British Columbia, Ontario, Quebec. It was managing those. You weren't getting substantial secondary spread and then stopping those chains of transmission. That's a better track record than a lot of countries have. Not perfect, of course.
As infection concerns spread around the globe, many countries like the United States, Singapore, Australia, and New Zealand have imposed travel bans in the hopes of protecting their borders. So far, Canada has resisted.
Some people are wondering why there aren't travel bans as other countries have done.
Well, Canada proved that the trick was not travel bans, that the virus is going to move anyway. I mean, some people are asymptomatic for a while. They incubate the virus for days, for weeks, and move around. And travel bans give you, number one, a very false sense of security. Number two, may slow things by a few days, maybe a few weeks, but they will not prevent spread.
And it's not just government action. Dr. Aylward says citizens must make changes to the way they live while we're in the midst of this pandemic.
This is a respiratory virus at the end of the day, which means it can move very easily from me to you. Well, not right now because you're too far away. But
this is the right distance? We're happy with this distance?
We're good. If your population knows how to protect itself, you're going to be very successful with this disease. If I'm washing my hands, if I'm proper respiratory hygiene, avoiding the others, social distancing, and know what to look for, not just in myself, but in others, I'm going to be safe or quite safe. There's no such thing as zero risk, but you can really reduce the risk. I spent 2 weeks, nearly 3 weeks, in the epicenter of the biggest outbreak in history. I'm fine.
Because this is such uncharted territory, there is no way of predicting just what happens next. But Dr. Aylward has some educated guesses.
One is the wishful thinking scenario where the virus just disappears and goes its own way, and we get it back under control, get the genie back in the bottle like we did with SARS. But you wouldn't plan for that. The second possibility is that we're going to see waves of this as it moves through seasons, through populations. They get it under control, it comes back, get it under control until there's more immunity in the world. And a third scenario is that we have this big wave that comes through now, and then you get low-level endemic disease, meaning you get sporadic cases happening in clusters, et cetera, that you have to manage. So at this point, it's hard to predict, but you would not plan based on the first scenario. You plan based on the latter two, and to do that, you build enough capacity to manage these.
Do you think that it will be contained?
I think it can be contained. It is a controllable disease, and you know, I'm a great optimist in the fact that people will contain it. I just hope that they will take the necessary actions early enough that it doesn't do the damage this virus is capable of. Because everywhere you look, as this escalates, you see countries taking extraordinary measures that a few weeks ago everyone said impossible. The classic is they did something in China that could never be done anywhere else in the world. How different is what's happening in Italy to what happened in China? Seriously, let's never say never, because you don't know this virus.
The vast majority of people who get this disease will survive. And Dr. Bruce Aylward hopes that the world will learn from this pandemic.
Every single event that we have like this is a dress rehearsal. We've changed our relationship fundamentally with nature over the last decades. And what we're seeing here is a virus that has jumped that animal-human barrier. This is just the most recent. There's dozens and hundreds of these, and it's happening more and more frequently because we live closer to nature in some areas than we did. Climate change is affecting this. We're encroaching on nature and natural resources. We travel differently. All of these things are adding up. So everything's a drill, but never, and this virus is teaching us, never think you know everything, because you don't.
Now, to keep things in perspective, COVID-19, with a mortality rate of 3 to 4%, is hardly the deadliest outbreak in human history. The flu pandemic of 1918 had a death rate estimated to be up to 20%. And during the Middle Ages, bubonic plague is estimated to have killed between 30 and 60% of Europe's population.